Are you getting ready to see a doctor or maybe a physical therapist about your knee pain, and you're wondering what questions you should have answered before you walk in the room? Well, today we're going to talk about the questions that I always ask all of my patients. However, I know that when you're seeing a typical doctor's visit, you don't have the time to actually go through all of this information in a facilitated manner, shall we say. So I'm going to empower you with the questions today. I encourage you to at least think about them, potentially even write them down and write down the answers. And that way, when you walk into the doctor's office or the physical therapist's office, you can present them with this information beforehand in a really concise manner. And that way you're able to expedite your time in the best possible manner. Are you ready? Here we go. Here's the questions that I always ask my patients when they come in, either for a discovery visit or at the beginning of the evaluation. We spend about 20 to 30 minutes having this conversation, so we're really clear on what it is that's going on, but also what their goals are and what they're trying to get back to, because that really determines a lot of what we're going to do. Depending on your goal, if your goal is to walk versus run and you have knee pain, that's a very different level of strength and flexibility that you need to be able to have. So we want to make sure here at Physical Therapy for Everybody, we want to make sure that we're achieving the goals that the patient has in mind. So we need to know where we're starting and we need to know where we're going. And that's why I feel like these questions are so important. But I understand a lot of times in a more traditional setting, you just don't have that 20 to 30 minutes to have that conversation. So I'm going to empower you with the questions. You can write them down or at least think about them and be able to present them to your doctor or your physical therapist to be able to get to the outcomes that you're looking for. First question, what happened? This can be a really, really broad question because for some of my patients who come in here, what happened was 5 to 10 years ago. Or maybe what happened was when they were a teenager and they're now in their 50s. But what was the initial injury or initial time that you noticed that you had this pain or dysfunction? And it's important to know how long ago it was. If this was something that happened, a week ago, it's going to have a very different presentation than if it's something that happened 20 years ago and now your body has adjusted, changed how it moves and functions in life because of this pain. So it's really important to know what happened and how long ago it happened. If you don't have an injury, then this would be, when did you first notice this pain or dysfunction or knee giving out or clicking or grinding, whatever it is, when did you first start to notice it? And I know that can take a while. If you've been living with it for a while, you can be like, I'm not exactly sure. But even a general time frame, 6 months ago, 12 months ago, 5 years ago, can really help us, especially when we're creating that plan to move forward, to know how long it's going to take you to heal. When does it hurt? Your knee pain may hurt after you go running. Your knee pain may hurt after you've been sitting at your desk working. Your knee pain may hurt after you've done the dishes after dinner. Your knee may be bothering you at a different time than somebody else's. Maybe it's when you sit down to watch TV at night. It could be anything. It could be with activity. It could be with rest. Everybody's knee pain is different. So when does it hurt? That's really important to know because that tells us more about if it's more activity related or more inflammatory related. And if it hurts every time after you go running, so maybe it doesn't hurt while you're running, but it hurts 6 hours after you go running. Again, that's important information because that helps us to understand what is actually driving the pain. If it's an inflammatory process that's driving the pain, you'll see it after the run. If it's a mechanical issue that's causing the pain, you'll see it during the run and maybe after too because of the inflammation that happens. But it really helps us to clue in on specifically what's happening with you and helps us to be able to make the best treatment plan that's tailored to you. Where does it hurt? That's a really important question because, again, everybody's knee pain is different. Now, what I ask my patients to do, if it's possible, is to use one finger to point to where it hurts, or at least where the pain starts from. If you can put one finger on the one spot that is the worst, That is really helpful because we know what structures are underneath there. So it can help us be able to make that diagnosis a little bit easier. Now, I do have some patients who maybe it started with one finger, but that was 5 years ago, and now it's the entire knee, and they will do that. They will rub their entire knee. And if that's you, that's okay too. But if you can think back 5 years ago, or whenever this pain started, where did it first hurt? That helps us to figure out which structure was affected first, and then what's been going on since then. We can figure out the whole path that your body has gone on, especially if this has been a long-term issue that you've been dealing with. Because at this point, you're not just dealing with the initial injury, you're dealing with what your body has done to compensate for that issue over time. What have you already tried? And maybe even more importantly, did it work? So I've had patients come in and they've tried a multitude of things. Some of them have tried literally everything. But the question is, did it work? Did you try ice? Yes. Did it work for a short period of time? I've had some patients who have tried heat and felt like it worked, but then felt worse the next morning when they woke up because it increased the inflammation. I've had patients try over-the-counter pain medication, prescription pain medication that they were given by their doctor. I've had patients who have tried injections already, and there's all kinds of different injections. We can talk about that in a different video, but what did you have injected? At least, generally, what was it? And did it work? And for how long in that case, particularly? Because some people can get an injection relief for a couple of days, some people get it for a couple of months. So it's good to know exactly how long it lasted, because that tells us a lot about the state of the tissues at this point. If you've tried any exercises, if you've gotten on YouTube or Google and found anything that you did it make things better or did it make things worse? Again, all of this is information that we use to kind of put the puzzle together as to what's going on with your body. Particularly, again, if it's been a long-term, long-standing issue, then we need to know what you've already tried. Because obviously, we don't want to waste your time on something you've already tried. If you are icing it, for 20 minutes every night, 2 to 3 times, and that's only helping to manage the pain, well, then we're not going to be like, oh, well, you just need to ice it more, right? I mean, it's like, keep icing it. Obviously, it's managing the pain. That's great, but we're not going to add to that. So knowing where you've been and what you've tried is a key indicator. Now, especially if you're going to see a physical therapist, and this happens a lot here where we have people who have been to see a physical therapist and did not get the relief they were looking for. Now I want to know, what did that physical therapist do? So I want to know, did they do stretches? Did they do exercises? Did they do any hands-on work? Did they work on the joints? Did they work on the soft tissues? Did they do ultrasound? Did they do e-stim? What were the modalities, the treatments that you got when you saw that physical therapist? Because obviously, we don't want to repeat it if you didn't get the results you were looking for. But then again, if my treatment plan after the evaluation is going to be what the other physical therapist did, then I need to help you find somebody who has different modalities for you to try. Because here in our clinic, we don't have ultrasound, we don't have e-stim, which usually isn't a problem for our patients because they've already had that stuff and it didn't actually work, which is why we don't have it in the clinic. But I want to make sure that the manual therapy, the hands-on treatment that I offer, is what's going to be best for your body at this point. And it's also good, and I totally get it, if you've already been to a physical therapist for this problem and you did not get the results you're looking for. I totally understand that you may be like, why are you going to be able to help me? Why is a different physical therapist going to be able to help me? And if that's you and you're in this situation, then I definitely encourage you to talk to the new physical therapist about that. I have absolutely no problems, and it happens quite often. When people have been to a physical therapist for their knee pain and not gotten the results that they're looking for, they want to know from me beforehand, before they commit to me, what are you going to do that's different? I do not have a problem answering that question. I want to find out what they've done before and what their results were of it, and then I'll talk to them about my approach and what I think would be best for them. And if they feel like that's not going to be helpful, then I totally respect that. but give me the chance to at least talk to you and find out if we're a good fit for each other. So if you're going to see someone, a new physical therapist, and you've already done that before for this problem, they do not have a problem being asked those questions. So feel free, because I'd rather you ask that question and we have that conversation and we make sure we're on the same page before we get started than have any kind of confusion or disappointment or frustration at any point along the way. So definitely feel free to ask that question. The next question is, what makes the pain better or worse? This may have been covered with some of the other questions, but I'm looking for more specific things. So it's not just that when I go running, it hurts while I run, or it hurts after I run. I'm looking for really the specific movements. And a lot of times it's when people plant one foot and have to turn the other direction. So we call that like a pivot shift type of motion. When that happens, they really get that knee pain. So that's what I want to know from you, is what particular motions or particular positions or particular activities are really pain-inducing or inflammation-inducing or make your symptoms seem much worse. Again, this helps us to really understand which tissues are bothering you, which gets you the most effective treatment in the quickest time possible. The next question, I wouldn't say I ask my patients, but I definitely encourage you to think about, because in my clinic, we have the time to have the conversation that this question ends up getting answered, and I think it's very important. I understand that in more of a traditional based facility, you may not get the time to really think about or discuss this question, so that's why I put it in here, but I definitely encourage you to think about it beforehand. What are your thoughts and concerns? I've had a lot of patients come in and tell me they went to physical therapy somewhere else and they felt like the exercises were not helpful, and then they tell me why. It wasn't helpful because I was putting weight on my knees. It wasn't helpful because I had to bend my knee too far. It wasn't helpful for a very particular reason. This is great insight. You know your body better than anybody else. So throw these thoughts out there, because this is going to be really helpful as we're doing the evaluation, figuring out the tissue and lesion, and learning more about your body and what your body's tolerance is. Your thoughts and concerns are super helpful, especially in creating that treatment plan and crafting that unique path for you, your body, your knee, and getting you back to what you want to do. Which leads us to the next question. What are you missing out on in life? Here at Physical Therapy for Everybody, when we're goal setting, the goals are always set by the patients, and it's always what they want to get back to. Walking, running, hiking, swimming, biking, picking up their grandkids, being able to stand up and make dinner. Whatever is your goal, that's what we're going to be training to, and that's what we're going to be setting as the goal, right? I don't care if your knee range of motion improves by 5 degrees if it doesn't help you to be able to do what you want to do. So what is it that you want to be able to do? What is it that you're missing out on? What is it that you're limiting yourself on? What's the activity that you avoid because it's just too painful, or it's going to be too painful afterwards and you just don't have time to deal with it? What are you missing out on in life? This question we definitely spend a lot of time talking about around here, and I make sure before I type up the evaluation that I know exactly those goals that the patient wants to get back to, because that's what we're going to be working towards during the entire treatment process. It may take a while to get there, and we usually try to set some shorter term goals along the way because it's always nice to see that success. But we want to know, what's that big, hairy, audacious goal that you want to get back to? Is there something you want to train for? Is there a big trip you want to go on? What is it that you want to be able to do? What is it that you want to feel comfortable doing? What is it that you don't want to have to worry about having any pain or dysfunction when you're doing? So there it is. There's your questions. I really recommend that you spend some time thinking about these, and that you present them to your doctor, your physical therapist, your healthcare professional, whoever you're gonna see. I think you can see that once you've had a chance to think about them, it should only take about 5 minutes to present all of this information if you've thought about it and have it in a really concise pattern. And I feel like that would be really helpful for you to be able to get the best outcomes from not only that appointment, but from your treatment plan. I hope this has been helpful for you. If you like this kind of content, definitely hit that subscribe button. Have a great day, everyone.